current events in medicine, or public health. And public health includes the promoting of health of all people. And just as a trigger warning, today we will be discussing mental health issues and self-harm. So what is public health? Public health is protecting and improving the health of all people and communities, regardless of where they may be located geographically. Um, and this includes promoting healthy lifestyles and researching disease and injury prevention, as well as detecting, preventing, and responding to infectious diseases, such as what was just happening with the COVID-19 pandemic. And public health finally includes advocating for healthcare equity, quality, and accessibility. So right now there are 7 current public health challenges, and the first of these is the healthcare system. So there are vulnerabilities that exist in the healthcare system regardless of income, and half the global population actually lacks access to essential healthcare services. And our second is mental health crises. So mental health concerns have increased to have a higher incidence than cancer worldwide, which pushes to fund mental health support programs. Our third is malnutrition and food safety, and this affects 29% of the world's population. And this is because globalization of food production, so more trade between different continents, has increased the extent and speed of foodborne pathogen transmission. And our fourth is infectious diseases. So the emergence of new infectious diseases calls for the improvement of healthcare quality, so that patients can get better treatment and financial assistance to public health. Our fifth is environmental pollution. So this threatens humans, wildlife, and habitats, and they may also trigger security and political threats. And climate change does also play a factor in environmental pollution. Our sixth is cancer. That is globally a leading cause of death, and lack of access to healthcare contributes to mortality rate in many different countries. And our final one is substance abuse. So substance abuse includes the excessive use of alcohol, pain medication, or illegal drugs. And the only current strategies right now are and criminalization. So people who work in the public health fields are looking for different ways that we can prevent substance abuse. So first, let's go over what a healthcare system is. So the World Healthcare Organization defines a good healthcare system with 5 different qualities. The first one is that it is safe and effective. So that means that it should take in each individual patient's unique needs, preferences, and values. The second one is timely. So that means that the wait times are minimized to avoid any harmful delays. So for example, like the emergency room, you won't have a really long wait time. That might decrease your chance of survival. The third one is equitable, so that means that we all have equal access to essential care. The fourth one is integrated, so that means that there's a full range of healthcare services that are available to a person throughout their lifetime. And finally, we have that it is efficient. So that means that the benefits are maximized and there's the possible waste possible. So right now, there are 4 models of existing healthcare systems. Our first one is the beverage, which is used by the UK. That means that healthcare is paid through taxation, and the health facilities are government-owned, and the health providers, like doctors, are employed by the government. The second one is the Bismarck, which is used by Germany. So that means that the hospitals are privately funded. There are mandatory payroll deductions for healthcare, so those are called sickness funds. And the care facilities are reimbursed. The third one is the National Health Insurance system, which is used in Canada. That's paid through taxation, and the delivery of the healthcare services are privately owned. And then the fourth one is that they're uninsured, so those who can pay will receive healthcare, and those who cannot pay do not receive healthcare. So the US used a combination of all 4 models. So that means that 28 million Americans are left uninsured. So there are many major systems with our system, including preventable medical errors. So this causes 250,000 deaths per year. which is the leading cause of heart disease, which is the leading cause of death after heart disease and cancer. Their high cost of care. So they were 15% higher in 2018 than 2014, which is a large jump for only 4 years. There's lack of insurance coverage, so many people don't seek healthcare for treatable issues since they don't have insurance that can cover their healthcare payments. There's a nursing and physician shortage, so the demand for healthcare providers keeps growing, but there aren't enough people to satisfy that need. There's uneven care, so that varies based on location, condition, and your insurance plan. So, for example, there's uneven care if you lived in a rural place than an urban place. There's lack of efficiency, so clinical documentation and electronic medical limit a physician's ability to provide care to their patients and off days. So many patients can only get service on weekdays, not at night or on the weekends, which can be a problem for people who work um, during the weekdays or people who, have to work during the day and they can't really get service when the hospital's open. So we also have mental health crises, and so there's long-standing mental health crises, and they've recently been exacerbated by the isolation of the COVID-19 pandemic. And suicide is the second leading cause of death in people aged 15 to 24. So 20% of high schoolers report serious thoughts of suicide, while 9% have made an attempt on their life. And mental health has been found to be linked with social media. So 32% of teenage girls on Instagram have reported feeling bad about their bodies, 40% reported feeling unattractive, and 25% of teenagers do not feel good enough. So there are pressing issues that can also affect our mental health, such as climate change, as we question the planet's habitability and the actions of our government and political leadership on climate change. And there's also mass shootings. So over 200 mass shootings have occurred by June of 2023. And anxiety related to these attacks can have a huge impact on our mental health. And then we have malnutrition and food safety. So unsafe food creates a cycle of disease and malnutrition, and this can affect infants, young children, elderly, and sick individuals. And the safe food supply contributes to food security, supports national economics, trade and tourism, and can stimulate a sustainable development. So when food is not safe, it can carry bacteria, viruses, parasites, and chemical substances that can cause more than 200 million diseases, from diarrhea to cancer. And about 600 million people, so 1 in 10, fall ill every year after eating contaminated food, resulting in 420,000 deaths and the loss of 33 million healthy life years. And some challenges include changes in our food supply and changes in our food production based on where they're imported and exported. Changes in our environment, so that also links to climate change, and new and emerging bacteria, toxins, and antimicrobial resistance. So then we have infectious diseases, and this includes diseases that can be passed directly or indirectly from person to person. So that includes like flu, measles, COVID-19, or salmonella. There is an increasing scope of infectious diseases, and the outbreaks call for an improvement in healthcare services that are critical for effective measures. So the effect of COVID-19 on public health. Research conducted on 36 infectious diseases following increasing trend interpandemic before increasing after the conclusion of social distancing. So 36 infectious diseases decreased during the pandemic when we were socially distanced before increasing again after we stopped socially distancing from each other. Untreated sexually transmitted diseases are important causes of female infertility because due to the many did not have access to screening. And there's also congenital syphilis in pregnant women, and the lack of screening prevented detection, which is the same as the untreated STDs. We have environmental pollution. So environmental and air pollution can cause health problems such as respiratory diseases, heart diseases, and some types of cancer. So around 12 million people die per year because they live or work in unhealthy environments. And people with low incomes are more likely to live in those polluted areas and drink unsafe water. Human activities also affect environment by producing pollutants in the water, air, and soil. So long-term effects of air pollution include chronic asthma, pulmonary insufficiency, and perinatal disorders. So that can include infant mortality and chronic illnesses in adults. And researching environmental pollution and creating policies to reduce different types of pollution can prevent serious health problems and even death. And then we have cancer, which occurs when genetic changes interfere with cell growth, and that leads to uncontrollable growth in the cells. So, public health scientists right now are working to develop interventions to reduce cancer risk, support research to reduce cancer disparities, since certain groups can suffer from cancer disproportionately, and ensure that cancer survivors have the best quality of life because many suffer from lingering health problems caused by the disease. So over 8.9 million Americans are affected by cancer at some point in their lives, and that means that over $156 billion are spent on cancer per year. And moving forward, researching cancer can allow us to raise awareness, um, and have more prevention causes, and also support patients. So raising awareness can really help with donations and funding that can provide for the research or support the patients. And here are some career pathways for public health. Always go into public policy, so creating laws to change public health systems. Epidemiology, so that's the field where you study infectious diseases. Biostatistics, you have health education, nutrition, maternal and child health, global health, and also public health administration. So public health professionals analyze and consult public policy. They can create and implement public health education proposals, investigate the origin of a disease and also what the best treatment of that disease is, and also research and analyze demographics to prevent disease outbreaks. And for public health degrees, you can obtain a bachelor's or a master's degree. So here in California, we have 3 degrees of public health. You have the bachelor's degree. It's a bachelor's of arts since it has cultural and economic aspects. You can have a bachelor's of sciences, so that focuses more on natural sciences, mathematics, statistics, and chemistry. And there's the 4 P's of public health. So those are prevention, promotion, protection, and population-based care. You have the master's degree, so there are different specializations that you can get a master's in. Those include health communication, health policy, program planning and evaluation, and global health. And these include internships, semester-long research projects, and grant proposals. And undergraduate degrees in health administration, business, nutrition, healthcare, and education. And finally, you have your PhD. So that is in population health science. You have doctoral level research and training. You understand the origins and determinants of health and disease. And the different fields of study are some of what we covered: biostatistics, environmental health, epidemiology, health policy, and social and behavioral sciences. So biostatistics is a field that uses statistics to answer questions. So those include like, will a new drug work? What causes cancer and other diseases? And how long will a person with X disease live? They'll gather and analyze data on biological factors, such as infectious diseases and pathogens. So how do they impact our health? And this includes how contagious and lethal a disease is, a population's response to a pharmaceutical drug. They'll have lots of medical research and clinical trials, and they can also gather data on how effective a public health campaign is. And a biostatistics background is vital in epidemiology, nutritional and public health well-being programs, environmental health, health services research, and development of healthcare policy and management. Environmental health covers how the environment affects people. So, for example, that includes toxic chemicals and consumer products, climate change and air pollution effects, and the consequences of oil spills and water contamination. And people who work in environmental health design experience, gather data, perform analyses, and research environmental factors that affect our well-being. Um, Infectious disease and disability involves these different fields. So there's reproductive and developmental biology, epigenetics, genomics, and structural biology, stem cell research, biomolecular screening, immunology, inflammation disease, toxicology, and toxikinetics, neurobiology, pediatric neuroendocrinology, cell signal transduction, and cellular and molecular pathology. So epidemiology studies what causes disease outbreaks to treat existing disease and prevent future outbreaks. And this includes how diseases are transmitted and following effective treatment, why certain diseases occur in different groups, and noting and analyzing patterns in disease occurrence and the populations affected. So the information gathered by epidemiologists is used to develop and improve both clinical and medical research and preventative healthcare. And epidemiology is involved in health science, medicine and nursing, biostatistics and modeling, and health administration. So health policy is defined by the World Health Organization as actions, plans, or decisions taken to achieve specific health goals. So these include defining a vision for the future through a specific health policy, outlining health priorities, establishing targets and reference points for measuring progress towards health goals, defining roles of specific groups involved, and educating and informing people while building a large consensus. So current health policy focuses on health promotion and disease prevention, patient safety and consumer protection, HIV and AIDS, healthcare policymaking, research, government health insurance programs, and healthcare access. So social and behavioral sciences include subjects such as sociology, psychology, and anthropology. Behavioral scientists study behaviors of groups and individuals,